If you have kids returning to school, this is a good time to be aware of some dental challenges and to reinforce some healthy habits. I'm Rochelle Grossman with your latest health news. Experts say parents are instrumental in maintaining healthy oral health, and that means being wise about lunch habits, flossing, and protecting your kids' teeth. It's recommended that parents send their kids to school with flavored water and 2% milk instead of chocolate milk or fruit juices, which can be high in calories and sugar. If your child plays high-impact sports, consider purchasing a mouth guard to protect their teeth. Past studies have shown that children who have dental problems don't perform well. You should speak with a dentist immediately if your child has dental pain.
Women who have pregnancy complications may feel relieved when a healthy delivery is in the past, but if you had high blood pressure during pregnancy, you may want to let your post-pregnancy physician know. I'm Jennifer Dodd, and this is a Dailyrx Minute. A recent study found that women who had pregnancy complications related to high blood pressure were more likely to have risk factors related to heart disease and diabetes a few years after giving birth than women who didn't have high blood pressure during pregnancy. Tell your primary care doctor if you had preeclampsia. For Dailyrx TV, I'm Jennifer Dodd.
Although children have been eating more fruit in recent years, they still may not be eating enough fruits and vegetables overall. I'm Erin White with your latest health news. The CDC recently released guidelines for fruit and vegetable consumption per age group and tracked average intake. Based on the newest data, most children needed to increase both fruit and vegetable consumption to meet the guidelines. The researchers wrote that eating more fruits and vegetables adds needed nutrients, reduces risk of death and illness, and helps manage body weight. Incorporate fruits and veggies into a healthy diet.
Amyotrophic lateral sclerosis, otherwise known as ALS and sometimes called Lou Gehrig's disease, is a nervous system disease that attacks nerve cells in the brain and spinal cord. These nerve cells transmit messages from the brain and spinal cord to the controllable muscles. No one knows what causes ALS, but it can run in families. At first, this causes mild muscle problems. The earliest symptoms may include twitching, cramping, or stiffness of muscles, muscle weakness affecting an arm or a leg, slurred speech, or difficulty chewing or swallowing. Eventually, strength is lost and it becomes difficult to move. When muscles in the chest fail, breathing becomes impossible. The disease usually strikes between age 40 and 60 years of age. More men than women get it. There is no cure, but medications to control excessive salivation and frequent coughing can help manage the symptoms. Patients with ALS should do breathing exercises and make sure immunizations are up to date. Physical therapy, occupational therapy, and rehabilitation may help to prevent joint immobility and slow muscle weakness and atrophy. Individuals with ALS may eventually consider forms of mechanical ventilation such as respirators.
As the popularity of youth ice hockey has grown in recent years, the injuries associated with it have grown as well. I'm Erin White with your latest health news. The American Academy of Pediatrics wrote that one of the most important ways to reduce injury risk was to expand programs to prevent body checking in the sport. Body checking is deliberately obstructing an opponent by putting one's body in their way. Dr. Michael Ishitani, a pediatric surgeon at the Mayo Clinic Children's Center, says due to the fast, hard-hitting nature of the game, people often ask what kinds of injuries might happen to my children.
The most common type of injuries were fractures, which may require splinting, casting, or even an operation to treat. The next most common type of injury was traumatic brain injuries, or more commonly known as concussions.
Speak with your child's coach about safety rules in their sport.
We may be reluctant to think about the waning days of summer, but it's important to prepare for the flu season as it's just around the corner. I'm Miranda Savioli with your latest health news. In a recent report, the U.S. Centers for Disease Control and Prevention provided recommendations for the flu vaccine, such as getting a flu shot for anyone over 6 months old. Children who are receiving the vaccine for the first time may need 2 doses 1 month apart. The live nasal vaccine is suggested for children as well. However, the report lists several factors and conditions that may rule out the nasal vaccine, such as diabetes, asthma, or taking care of someone with a compromised immune system. Wash your hands regularly and avoid sharing food to reduce your risk of catching the flu.
By translating health information into a consistent, easy-to-understand language, the Dailyrx News Network enables you to take control of your health. Sign up for the Dailyrx newsletter to receive the latest health news and videos right to your inbox every morning. For trusted, research-based health news, join us at Dailyrx.com. Your health starts here.
Many people now live into their 80s and beyond, and part of aging and living well means being able to get around. Orthopedic surgery to help patients who are 80 and older get around hasn't always been considered a safe option, but that may change. I'm Valerie Cabot with your latest health news. More people 80 and older are undergoing orthopedic procedures and recovering well, a new study shows. Although any surgical or medical intervention becomes more risky with advancing age, the morbidity and mortality associated with the described procedures are well worth the risk when weighed against the variable of mobility. The doctor noted, when we lose mobility, our muscles and skills deteriorate, putting us at a greater risk for various mental and physical ailments, as well as simple falls. They suggest walking and doing yoga to add years of vitality to a person's life. Learn the treatment options for an orthopedic condition.
Anemia happens when the blood does not carry enough oxygen to the rest of the body. Anemia is caused by not having enough iron. Anemia has three main causes, which are blood loss, lack of red blood cell production, and high rates of red blood cell destruction. Anemia can make one feel tired, cold, dizzy, irritable, and shortness of breath. In addition, anemia can cause headaches. Conditions that may lead to anemia include heavy periods, a diet that does not have enough iron, folic acid, or vitamin B12, pregnancy, and ulcers. In addition, certain conditions such as the following can increase the risk for anemia: colon polyps or colon cancer, inherited disorders, certain blood disorders, aplastic anemia, and G6PD deficiency. Treatment depends on the kind of anemia. Treatment may include vitamins such as vitamin B12 and folic acid or iron supplements. Erythropoietin may also be prescribed to increase the number of red blood cells in the body. Eating a healthy diet can help prevent and/or help manage anemia. Changes to the diet may be made to raise the vitamin and/or iron level.
Here is some good news for Americans waiting for a kidney transplant. Older adults who donated kidneys were not at an increased risk for heart problems, kidney disease, or dying. I'm Miranda Savioli with your latest health news. A newly published study from the University of Pennsylvania found older kidney donors did not have a different survival rate when compared to non-donors. There was no difference in rates of heart and vessel disease between the two groups, nor was there an increased risk for diabetes, low thyroid function, or osteoarthritis for older donors. However, older kidney donors did have a 53% greater chance of being diagnosed for non-melanoma skin cancer. But the study's authors feel this may be because donors might visit their doctors more often. Speak with your doctor if you are considering a kidney donation.
Tuberculosis, or TB, is a disease that is caused by bacteria called Mycobacterium tuberculosis. Tuberculosis can cause symptoms such as a bad cough that lasts 3 weeks or longer, weight loss, loss of appetite, coughing up blood or mucus, weakness or fatigue, fever, or night sweats. The bacteria usually attacks the lungs, but can also damage other parts of the body. TB spreads through the air when a person with TB of the lungs or throat coughs, sneezes, or talks. A weak immune system increases the risk for TB. Being a healthcare worker can also be a risk factor for TB as well. If not treated properly, TB can be deadly. TB disease can usually be cured by taking several medications for 6 to 9 months. The medications used to treat TB include the following: isoniazid, rifampin, ethambutol, and pyrazinamide. Patients diagnosed with TB should avoid alcohol and should stay home until a doctor says it's safe to return to work or school.